Let us see the different types of autopsy. Let us see the different types of autopsy. The first autopsy is called as medico-legal autopsy. That is the first type, medico-legal autopsy, right? This medico-legal, as the name implies, medico-legal, it is done in medico-legal cases. What are the medico-legal cases? Accident, homicide, suicide, suspicious death, all are medico-legal cases. So you can put it simply like it is done in unnatural deaths. It is done in unnatural death. So that is medico-legal autopsy. It is done in unnatural deaths, right? In India, this medico-legal autopsy is the most common type. Okay, of all the types of autopsy in India, the medico-legal autopsy is the most common type of autopsy, right? I told you this is done in medico-legal cases. Who will give you authorization? The authorization is given by IO authorization. IO authorization. You can ask me, sir, what is that IO? IO means is nothing but investigating officer. The investigating officer will give you authorization. He will give you letter for permitting the medico-legal autopsy. We have seen in India, we have already discussed there are two types of autopsy in India. One is police inquest, other one is magistrate inquest. So depending on the type of autopsy, that particular investigating officer will give you the authorization. He will give you the request to conduct autopsy. After receiving that authorization, you can start the autopsy, right? Medico-legal. See, after getting authorization from the investigating officer, are you going to the relatives and ask permission? Sir, can we do autopsy in your relative's body? No. Relatives' consent is not necessary here. Relatives' consent, it is not necessary. In medico-legal autopsy, relatives' consent is not necessary at all. You don't have to get consent from the relatives because you have already got the authorization from the investigating officer. So you don't have to get consent from the relatives, right? Suppose, having completed the autopsy, whom will you hand over the body? That is another very important NEET question in the past, right? The body will be handed over to the relatives, okay, RMO, to the High Court or to the police officer. Whom will you hand over the body, right? From whom you got the authorization to do autopsy? From whom you got the authorization, friends? It is from the IO. So after autopsy, you have to hand over the body to the IO, to the police officer. Okay, so after the autopsy, hand over the body back to the investigating officer. So this is about medico-legal autopsy. I have told you this is so important for us because it is most common autopsy in India. Okay, this is most common autopsy in India. So let us go to the next type. Okay, first we have seen medico-legal autopsy. The next important type is clinical autopsy. Clinical autopsy, also called as pathological autopsy. See, I have told you medico-legal autopsy was done in unnatural deaths, but this clinical autopsy will be done in natural deaths. It will be done in natural deaths, right? You can ask me, sir, it's a case of natural death. Why do you want to do autopsy? Yes, this is a case of natural death, but this is done to know the pathology. Suppose if the person dies suddenly, you want to know the cause, there you can do this autopsy. Here, what happens is you are doing autopsy for academical interest. Right? You want to know the pathology present in the body. You want to, for academical interest, you are doing this clinical or pathological autopsy. Right? Here, it is not the IO because it is not medico-legal cases. So, the investigating officer does not come into the picture. Here, the relatives will ask you to do autopsy. Here, the relatives will give you consent. Here, the relatives will give you consent, and in other words, the relatives' consent is mandatory in this situation. You have to get consent from the relatives, then only you can go with clinical or pathological autopsy, right? It is done in natural death. You can say the relatives' consent is mandatory, very, very important. The next type of autopsy, is called as virtual autopsy. It is called as virtual autopsy. It is also called as virtopsy. You combine both the words, virtual autopsy, you combine it becomes virtopsy. What is this virtual? Remember, it is virtual. You're not doing actual dissection. But what you do is you do whole body CT scan, whole body imaging. You can either do a CT or MRI. When you do whole body imaging, whatever lesion that is present in the body, it can be easily detected. It can be a fracture, it can be a structural pathology, it can be easily detected when you do a whole body imaging. Right? Within few minutes, you can tell the cause of death. In most of the developed countries, this virtual autopsy is being conducted. You can easily find out the cause of death. Right? That's called virtual autopsy. The next autopsy is called as psychological autopsy. Next autopsy is called as psychological autopsy. See, let me tell you one important keyword. This psychological autopsy is done in suicidal cases, where if you want to assess the mental status of a person, in other words, if you want to find out the psychological status of the person before committing suicide, you can do this psychological autopsy. Right? See, if you want to find out the mental status of the person before committing suicide, if you want to find out the mental status, psychological status, right? How will you find out the psychological status before committing suicide? You can have interviews. You can have interviews with parents, with friends, with relatives. You can say it is with the closest circle. Okay, you can have interviews, verbal interviews. You will be interacting with the people who are around the person verbally, okay, in the form of interviews. Very, very important, in the form of interviews, right, verbally. That is why this psychological autopsy is also called as verbal autopsy, right? This is also called as verbal autopsy, psychological autopsy, verbal autopsy. So you have to know both the terminologies. When you know both the terminologies, psychological autopsy, it is to assess the psychology of the patient. Verbal autopsy, it is done verbally. So that's why it is called as verbal autopsy. As I told you earlier, it is done in suicidal cases. It is done in suicidal cases. Remember friends, in suicidal cases, normally they will do medico-legal autopsy. That is separate. After that is to find out cause of death. You will do medico-legal autopsy in suicidal cases to find out the cause of death. But in addition to that, if you want to assess the mental status, you can do this psychological autopsy or verbal autopsy, where you will be having interviews with the closest people. Right? So that is called psychological or verbal autopsy. The next important autopsy is called as negative autopsy. Okay, it is called negative autopsy. What do you infer from this word negative autopsy? Right? What do you infer from this word? You see negative means all the findings are negative. You see negative autopsy, all the findings are negative. You would have done proper dissection. You would have done proper dissection. You would have sent the organs for chemical analysis for detection of poison. You would have sent the organs for HPE, histopathological examination. You would have sent some organs for microbiology. But all these reports are negative. All these reports are negative. When all these reports are negative, then you call it as negative autopsy. What is the cause of death here, friends? What is the cause of death? Yeah, when everything is negative, you cannot tell the cause of death. You cannot tell the cause of death. You cannot opine the cause of death. The cause of death cannot be commented. It cannot be opined. Okay, because that is also negative. All the reports are negative. Cause of death can also be negative. You cannot tell the cause of death. This commonly happens when a person is suffering from, say, for example, if he is suffering from vagal inhibition. Death due to vagal inhibition, death due to sudden cardiac arrhythmias. So you cannot tell the cause of death by dissection, by sending the organs for analysis. So everything will be negative. When everything is negative, you call it as negative autopsy. Say I have told you medico-legal autopsy, clinical autopsy, virtual autopsy, negative autopsy, and psychological autopsy. These are the 5 important types of autopsies, right? We have to know about. Right, they can ask you what is the most important, most common type of autopsy in India. The most common type of autopsy in India is medico-legal autopsy.